Bismillahirrahmanirrahim. So today's video is on gangrene. So let's begin. So gangrene is a death of body tissue due to a lack of blood flow or a serious bacterial infection. It commonly affects the arms and legs, including the toes and fingers. It can also occur in the muscles and in organs inside the body, such as the gallbladder. This is a condition that can damage the blood vessels and affect blood flow, such as diabetes or hardened arteries, and a condition known as atherosclerosis. And this can increase the risk of gangrene. So treatments for gangrene can include antibiotics, oxygen therapy, and surgery to restore blood flow and remove dead tissue. The earlier the gangrene is identified and treated, the better the chance of recovery. It can lead to serious complications if it's not immediately treated. So bacteria can spread quickly to other tissues and organs, and you may need to have amputation to save your life. Removal of infected tissue can lead to scarring or a need for reconstructive surgery. Here on the screen are a list of symptoms that can identify whether you have gangrene or not. And importantly, as an addition as well, if gangrene affects tissues beneath the surface of your skin, such as gas gangrene or internal gangrene, you can have a low-grade fever and generally feel unwell. If the germs that cause the gangrene spread through the body, a condition called septic shock can occur. So signs and symptoms of septic shock can include low blood pressure, fever, although some people can have a fever lower than 37 degrees, rapid heart rate, lightheadedness, shortness of breath, and confusion. So I can see here on the screen, there's a list of the symptoms. So changes in skin colour, swelling, blisters, sudden severe pain, followed by a feeling of numbness, thin shiny skin or skin without hair, and skin that feels cool or cold to touch. Causes of gangrene can be attributed to, firstly, lack of blood supply, so the blood that provides oxygen and nutrients to the body, and this can provide the immune system with antibodies to fight infections. If you don't have a proper blood supply, the cells can't survive and the tissue then dies. A second cause is infection, so untreated bacterial infections can cause gangrene. And the third one is traumatic injury. So if you have gunshot wounds or crushing injuries from car crashes, these can cause open wounds that let bacteria into the body. If the bacteria infect tissues and remain untreated, gangrene can occur. So there are different types of gangrene, so let's go through them all. So you have dry gangrene. So this type of gangrene involves dry and shriveled skin that looks brown to purplish blue or black. So this can develop slowly. It occurs most commonly in individuals who have diabetes or blood vessel diseases such as atherosclerosis. The next type is wet gangrene. So this is referred to as if wet if the bacteria have infected the tissue. You can have swelling, blistering, and a wet appearance. Wet gangrene can develop after a severe burn, frostbite, or injury. This usually occurs in people with diabetes who unknowingly injure a toe or foot. This needs to be treated immediately because it spreads quickly and can be deadly. The third type is gas gangrene. This typically affects deep muscle tissue. The surface of your skin can look normal at first, but as the condition gets worse, the skin can become pale and then turn other colours such as grey or purplishly red. The skin may look bubbly. It can make a crackling sound when you press on it because of the gas within the tissue. Gas gangrene is most commonly caused by the bacteria known as Clostridium perfringens. So bacteria can gather an injury or surgical wound that has no blood supply. So in this, the bacterial infection produces toxins that release gas and cause tissue death. So just the same as wet gangrene, gas gangrene is also life-threatening. The fourth type is internal gangrene. This affects one or more of the organs, such as the intestines, gallbladder, appendix. It can occur when blood flow to an internal organ is blocked. For example, if the intestines bulge through a weakened area of muscle in the stomach, if you have a hernia and become twisted. If this is left untreated, internal gangrene can become deadly. The next type is Fournier's gangrene. This involves the genital organs. It usually affects men, but women can also get it. An infection in the genital area or urinary tract causes this type of gangrene. You also have Melanie's gangrene, and this is the final type. This is a rare type. It's usually a complication of surgery, and painful skin lesions typically occur 1 to 2 weeks after surgery. Another name for this condition is also known as progressive bacterial synergistic gangrene. Let's look at the methods of diagnosis. So firstly, you can have blood tests. So if you have blood tests, you'll have your white blood cell counts measured, and a high white blood cell count is often a sign of infection. There are other blood tests that can be done to check for the presence of specific bacteria or other germs. You should have a fluid or tissue culture, So tests can be done to look for bacteria and fluid sample from a skin blister. A sample of tissue can then be examined under a microscope for signs of cell death. You can also have imaging tests such as X-rays, CT scans, and MRI scans, which can show the organs, blood vessels, and bones. These tests are quite useful in showing how far gangrene is spread through the body. Surgery can also be done to get a better look inside the body and see how much tissue is infected. Finally, there are 3 types of treatment that can occur, and we'll go through them one by one. So the first one is medications. So you have to have medications to treat a bacterial infection, and these are given either intravenously or orally. Pain medications can also be given to relieve discomfort. You can have surgery or other procedures, so depending on the type of gangrene and its severity, more than one surgery could be needed. So surgery for gangrene includes debridement. So this type of surgery is done to remove the infected tissue and stop the infection from spreading. You can have vascular surgery. This can be done to repair any damaged or diseased blood vessels to restore blood flow to the infected area. Amputation, if you've got severe cases of gangrene, the infected body part, which could be a toe, finger, arm, or leg, may need to be removed, surgically removed, in a process known as amputation. So later on, you can have this complemented with an artificial limb in a process known as prosthesis. You can also have skin grafting, also known as reconstructive surgery. So why that is surgery is sometimes needed to repair damaged skin or to improve the appearance of gangrene-related scars. This can be done using a skin graft. So what happens with a skin graft is your surgeon will remove healthy skin from one part of the body and place over the affected area. And this can only be done if there's enough blood supply to the area. The final treatment is a process known as hyperbaric oxygen therapy. This is done inside a chamber pressurized with pure oxygen. So you usually lie on a padded table that slides into a clear plastic tube. The pressure inside the chamber will slowly rise to about 2.5 times your regular atmospheric pressure. So this technique will help the blood carry more oxygen. So oxygen-rich blood slows the growth of bacteria that live in tissue lacking oxygen. It also helps infected wounds heal more easily. So a hyperbaric oxygen therapy session for gangrene takes around an hour and a half. So you do need like 2 to 3 treatments a day until the infection clears. That's the end of today's video on gangrene. I hope you've had fun listening to this, and if there's any video suggestions you would like, please get in touch and I'll be happy to make one. Thank you once again for your time. Bye bye.